Hello everyone, welcome to our latest community conversation. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today I am excited to be joined by Dr. Peter Bolo. He's the Chairman of Psychiatry at Overlook Medical Center and our Atlantic Health System Resiliency Advocate. Dr. Bolo, thanks for coming in.
Thanks for having me, Luke.
We are going to talk for about half an hour, as we do during our community conversations, but this is not just a two-person conversation. You have a role to play in this as well. So for those of you who are following along live on Facebook Live or on LinkedIn Live, be sure to leave a comment, and we will do our best to try to incorporate as many of those as we can into our discussion. And Dr. Bolo, if you'll indulge me for one more moment, just to tell our folks at home, there are a number of ways you can watch today's program. The live version, as we're doing now, is on Facebook Live and on LinkedIn Live. But the entire thing, when it's completed, lives on our website, atlantichealth.org. It lives on our Facebook page and on our social media channels. You can find links to it that way. And then you can also find it on News 12 Plus, which airs on weekends. So if you are watching it on TV on the weekends, we are not live. You will not be able to text your television. But it's great so that if there should be, by chance, just a little buffering in the signal, or the audio should drop out, or there be any kind of technical difficulty in how you're seeing it live, you can catch the full thing on any of those other platforms. So that's kind of the nuts and bolts of it. Dr. Bolo, I'm really looking forward to our conversation again, and thank you for being here to discuss this really important topic.
Thanks so much.
We titled it Anxiety, Uncertainty, and Coexisting with COVID. And I think, you know, in your travels, I'm really interested in hearing what you have seen and heard, both in your role here at Atlantic and then just in the communities that you're a part of, about how the last few months have been for people. And what are some of the things you're hearing from folks?
Yeah, well, I just start by saying that this is clearly a pandemic related to a virus and a very serious viral illness. But simultaneously, we have an emotional pandemic of anxiety. Everyone's anxious. So we can take some comfort and solace in the fact that we're all in that together as well. And I've seen a lot of people coming together to support each other through that. Have seen some people suffering alone and have some information I'd like to impart to them along the way. But I think it's really been an opportunity to bring us together, and again, through a shared sort of traumatic experience of living through a pandemic that continues, to find the common ground amongst us and to support each other.
How much harder is that when, I mean, it's rare. First of all, just for those who maybe wonder, Dr. Bolo and I are both masked and 6 feet away in distance. But even in productions like this, we do the best we can to limit the number of people we have in a single room, and as folks are social distancing at home or even at their places of work to the best of their abilities. How much does that complicate it, this inability to be near other people and to be around them? How much does that make a bad situation worse?
Well, as you know, we're social animals, right? We're networks. This is how we function. This is what we're used to. So to have to be this far apart and more, covered by a mask where it's hard to read people's facial expressions at times, is a challenge. So, and it's a additional source and burden for coping with anxiety, because one strategy to cope with anxiety is to stay connected to other people, family, friends, coworkers, and to take solace and comfort in each other and their presence. So it's a big challenge. Technology is helpful for some people. You know, there are platforms to go on and
chatting and all that.
Exactly,
kind of
all of that, which I think works really well for some people. There's some people that are challenged with that. Not everyone in our country has access to that.
Very true. Broadband service is not universal.
And there's something that doesn't quite come across as well as in person. And I've also heard from a lot of people that they very much miss the physical intimacy of being able to give their family members or friends a hug, for example. And that's really painful to a lot of people.
Yeah, I mean, and especially from a children's perspective, my kids have said the same thing about their grandparents, because obviously there's a tension about wanting to make sure that if there's elderly folks in your life, that you're protecting them, but at the same time looking out for them. So those walls, they do seem to complicate things a little bit. I want to touch on something that you mentioned a brief while ago, and that is this concept of anxiety, what anxiety is, how is that just the general sense of concern that people feel about a circumstance? What is anxiety?
Yeah, so I like to think of anxiety as largely the emotional response to uncertainty or some kind of threat. So, do we have uncertainty or some kind of threat during a pandemic? Oh, yes, we do.
Sure.
Everywhere you look, there's something else that's uncertain, unknown about it. The condition itself, who it's going to affect, could it affect us? Will it affect somebody else that I love? What's going to happen economically for us? What's happening economically in my family? What's happening with my work, etc. How long will it last? How do I manage through this? All of those things, what's a treatment that's going to be effective? Will we have a vaccine? When will we have it? When will I go back to school, etc., etc. So much uncertainty. So uncertainty or threat is the breeding ground of anxiety, which is just a feeling of nervousness. And it's a physical sensation as well as an emotional feeling that's very uncomfortable. It makes people feel panicky and worried, and that sort of worry and panic kind of feeds off of itself. And being around other people who are anxious, it's very contagious, so that can breed more anxiety. And listening to the media, which can be very dramatic,
Especially lately?
Yeah, can also heighten anxiety. So that's sort of what anxiety is about. And there's a few different anxiety conditions that people will talk about, all that kind of come under that heading. Those include things like panic disorder, where people will be sort of okay, and then periodically they'll have a panic attack that feels almost like you're having a heart attack.
Really? That dramatic?
Yes. A lot of people come to the emergency room with that, wondering, did I have a heart attack or am I having a heart attack? There's post-traumatic stress disorder, or PTSD, which a lot of people are talking about, because the pandemic is a traumatic situation. And different than many other traumas that have been studied over time, in that it's an ongoing, socially experienced, broadly, culturally experienced trauma.
Rather than a specific moment that happens at a specific
Exactly.
point in time.
So it'd be very interesting actually to study it because of that. But so that kind of trauma experience for some people, especially if they've had trauma earlier in their life, which has primed the pump, for some people they'll experience things like flashbacks or nightmares about different images or experiences from a traumatic situation that are very disturbing. They can feel a heightened sense of tension or a heightened startle reflex, be feeling jumpy, and also at times can feel numb or almost like cut off from emotions as sort of the brain's coping with trauma. And you can feel those different symptoms over time, and that's something that can go on for a number of months. It's something we're really working on trying to prevent in our workforce at the hospital,
Right, sure.
who have dealt with a lot of traumatic experiences, rendering wonderful care to these to patients suffering from COVID.
How are those things different from what some folks might throw into a catch-all bucket term of depression, right? Or is depression something that comes from something like that? And are they completely different, or is there enough of a similarity that there's a relation between
It's a really good question, and it's a tricky area to understand. So, depression and anxiety are not the same thing. I mean, I talked about what anxiety is. Depression is really the reaction to a loss or the threat of a loss. And that may be the loss of a loved one, or it could be the loss of work, the loss of your self-esteem for some reason, etc. Any type of loss can trigger a sense of grief that can go on to a depression. And when we talk about depression in the medical sense, it's really a qualitatively different mood that goes on for at least 2 weeks, every day. Most commonly feeling low or sad. At times, people feel more tense and keyed up more than the sadness, which can be tricky discerning it from anxiety. And then sometimes people feel less emotion, again, almost kind of cut off. And they have a whole lot of other symptoms that go with it, like difficulty falling asleep, less appetite, feeling poorly about themselves, their self-esteem, having difficulty concentrating, and even sometimes, which can be a grave emergency situation, thoughts about suicide or ending one's life. So that's sort of depression. And anxiety being what I spoke about before, they do have some overlap, and they can they can coexist in the same person. So you could have PTSD, and you could have an episode of depression. Depression tends to lift over time with treatment, and we've got great treatment for depression. PTSD and some of the anxiety conditions can tend to be a little bit longer lasting for people and wax and wane over time.
Have you seen, and I know that we are becoming more and more attuned and aware to these circumstances and people are becoming, and we'll touch on this a little later in our show, a little more comfortable in talking about those things publicly than perhaps maybe in years past. But how, in your opinion, has COVID-19 exacerbated these challenges for people? We touched on it a little bit in your opening remarks, but have you seen either in the number of instances you've seen, and of course anecdotally, not necessarily statistically, but has COVID made a bad situation worse in your opinion in that regard?
Yeah, well, these anxiety disorders and depressive disorders are definitely triggered or exacerbated by, or recurrent episodes or worsening of symptoms are caused by stress in someone's life. I can't imagine many things more stressful than a pandemic. So yes, we're seeing a lot of resurgence of prior conditions in people who had an episode of depression 10 years ago, again having symptoms now, for example, or people with bipolar disorder having an episode of depression or mania. It's also been difficult for people, especially early on, to access their usual treatment. So some people have not had access to their usual prevention treatment, and that's a really important point I want to make, that for people who have prior psychiatric conditions, that they're in touch with their psychiatrists, therapists, so that they're getting adequate ongoing treatment to help prevent them from having an episode.
I want to touch on coping skills, which I think are going to be really important, but one more on sort of the clinical nature of where we are before we go along. In terms of identifying these things within themselves, or people being attuned to their risk for some of these things, are there, or do these conditions affect people differently based on what makes us who we are, either genetic background or other factors? Are there things that make us more susceptible to these kinds of things, in addition to the fact that we are in the middle of a global pandemic?
Yeah. Number one, if you've had a prior episode, you're at risk of having another episode, as I was mentioning. Number two, if you have family history of depression, bipolar disorder, panic disorder, obsessive compulsive disorder, another anxiety disorder, or other psychiatric conditions, you will be more likely than the next person to develop an episode. Okay. And prior life experiences. As I mentioned before, if you've had childhood trauma or losses, or earlier in life losses or traumatic events, it tends to prime the pump a bit, and people are more susceptible to being traumatized again.
How do we build the supportive framework around us to deal with this? I mean, are there coping tools and mechanisms and things that we can offer our audience to help them cope with everything that's going on?
Yeah, well, first off, I think it's really important to get the word out about these things, with these conditions, which is what we're doing now.
Exactly. Yep.
So education, making sure that services are available and that people have access to services. So I just want to mention that for our outpatient behavioral health services at Atlantic, we have one number that people can call to get service throughout our region.
And we're going to put that in the thread. So for folks who are interested in that, we'll put those resources available to you online on Facebook and on LinkedIn or on our website too. However you interact with this program, we'll make sure that you're able to see it there.
Right, and that's called our access number, because it's access to outpatient treatment. And Yeah, so I lost the last part of your question.
Oh, I'm
there.
sorry. So
Had
in
to do-
terms of a structural coping mechanism, or
Oh, yeah.
either a support structure or tips and tricks. I mean, I hate to use such a sort of a catch-all term for it.
No,
but
that's
something along
that's.
those
I think
lines.
that's really critical. I mean, people are constantly asking me, understandably, what can I do with my anxiety? I think there are a few very important basic tips. One, take care of yourself. And I know that seems like kind of obvious, and duh, I'm doing that anyway. But actually, in the midst of chaos, people get chaotic about what they're doing oftentimes. So make sure that you're getting adequate sleep. You know, go to bed, try to go to bed and wake up at the same time. So practice sleep hygiene, getting adequate nutrition and hydration, getting some activity and some exercise, which can be hard as people were in a lockdown mode.
Sure.
If they don't have a home gym. Everyone can do some calisthenics at home or watch a workout video on television or online and exercise along. Or I think even the best option, since we've been in spring and summer, is to go outdoors. Not only to take in nature and to appreciate nature, and a lot more people are doing that now as we've had less opportunities for other entertainment, but also just to get outside and walk around, hike, cycle, whatever you enjoy doing. And actually I recommend that people do that with someone else at times, and it's possible to walk and stay 6 feet apart and to be socially distanced, and to be not only be getting some activity, clearing your head, but connecting with other people. Connecting with other people is another really critical part of managing anxiety. We already talked about different ways to do that. And it's interesting, like during a crisis situation, people are much more open to communicating, and so very deep channels of communication can open between people. So it's really an opportunity to take advantage of, to express your gratitude for other people, what you think about them, your positive feeling about them, what you value in them. So I think that's an opportunity and sort of a novel thing to do during this period of time that's uplifting to others.
Are people more receptive to that type of thing in a time like this as well?
Absolutely, and they're more focused.
I've heard this phrase used in several applications, and I want to see if we can, for our audience, share your personal definition of it. What is resiliency in this concept? What is being resilient in this?
So, at Atlantic, our definition of resiliency is bouncing back and even growing through challenges, enjoying what we do, who we do it with, and why we do it. So sort of speaking to that ability to sustain through headwinds, and that is also advanced by being connected with the people that we work with, or our families, and nurturing those connections by actually enjoying what we do and making it enjoyable, like we're doing today. I mean, this is fun sitting with you and talking about this stuff.
And some of this stuff, I mean, it sounds sort of to hear you talk about it, some people may say, well, that sounds kind of complicated, but in its most basic sense, it's just, it isn't. It's very straightforward type stuff.
And the last part of that has to do with purpose, why we do what we do. And I think it's really important to reflect on, why do I get up every day? What is my purpose in life? What is my meaning? How do I want other people to think about me, etc. So purpose is really important, and actually during the pandemic, when people are cut off from a lot of the things that they might otherwise be doing during their day, to give them that sense of purpose, I think it's helpful for people to feel or to kind of give into the creative urge to do something, to try to create a pandemic version of themselves that's different. A new purpose, a new mission, helping other people, for example, helping your neighbor, checking in on your neighbors, etc. Sort of different areas in which you can create meaning for yourself. That's uplifting.
Interesting. Are there, and we've touched on that a little bit in your previous answer, but this, can one make themselves more resilient in advance of a challenge, right? Do those steps, are they as much proscriptive ahead of time as they are once you find yourself in the middle of needing to react to something?
Absolutely. I mean, if you're connected to people and have people in your life that you can go to for support and have a prior relationship with them, that is something that's then available to you, just as one example. If you have an exercise regimen that you participate in that helps you clear your head and take care of your body and yourself, that is something that you can continue with during stressful times like this.
A couple of things I wanted to touch on that have come in to us over the last day or so. Al asked a question that I think some of us have seen in a couple of different ways. Some people that Al's responded with, or corresponded with lately, have sort of begun to shift their focus. Either they can't continue to think about COVID anymore, they just can't deal with the fact that this is still a reality anymore, and they just want to just dismiss it and get back to life as they used to know it. Can you talk about how that happens? I mean, fatigue, I guess, is mental fatigue for this kind of thing. Is that a normal reaction over a prolonged exposure to something like this?
Absolutely, and it's totally understandable, right? This has been a lot of work. It's turned everything upside down. We've been asked to do a lot of things that are outside of our norm, and I think people do get fatigued with it, and that is reasonable. I think that, however, in response to that sense of fatigue, rather than say, I'm just going to forget about all of this and be in denial, and maybe it's not such a big problem and not something that I need to continue to alter my behavior around, and I'm just going back to my former
no social
normal.
distancing, no masks, that
Exactly,
kind of thing.
but rather than doing that, work on other ways to get a break from it. You know, I'll just share some for myself. We've been having other friends over, a couple people on the weekend, more recently since things have opened up a bit, and sat in the backyard a good distance away, but sitting out in a beautiful yard in the beautiful weather and having a conversation, sharing a glass of wine, sharing some nice food. People bring their own though, actually, which has been kind of fun. And then we don't have to worry about intermingling silverware and service and getting too close to each other during that. But yet we have that connection, and we can talk about things other than the pandemic.
Something that can sort of harken back to another time.
Yeah, and so I think that's important for people to get back in touch with some of those, to gradually do some of those things that they used to do, and to get a little bit of a break, and to try not to talk about it all the time, and certainly don't listen to media all the time about it. It's too much and it's overwhelming, and that's another way to get a break.
Right, yeah.
Yeah.
Jennifer has a question about, and this is tied, it's sort of a clinical thing, but I think it's representative of a larger issue. She wanted to know about, the context of her question is feeling safe about going back to the physician and seeing her doctor, and so, and we've talked about that issue in a number of these community conversations, the things we're doing to make our facility safe for people to come back. But the question that I think is more relevant to our discussion today is this idea of, at least in what her mind is, the concept of risk-taking, of doing something, of getting yourself comfortable enough to do something that maybe makes you a little apprehensive on its face. In your experience, what are some good ways that people can kind of talk themselves into doing things that may otherwise seem a little intimidating or concerning?
So there's kind of two camps of people, those who are like big risk takers and kind of somewhat in denial and kind of going out there and not following all of the things that we've instructed people to do. And then there are the people who have almost done that and way more, and almost, if you will, isolated themselves a little bit too much for their own good. You know, been too scrupulous about this. For those people, and there are many of them, it's really scary going out, going back to work if you've been furloughed, you know, going to see a doctor, going out,
to
get takeout, to the supermarket, etc. So for those people, I think to be aware of the current recommendations is really important, and to heed them. And if our governor is saying that this is what you're allowed to do at this point, and this is how you can do it, wearing a mask, being socially distanced, whatever, waiting in line before you go into the grocery store, then I believe that it's safe to go ahead and do those things, and that you should do those things. And it's helpful to talk yourself through it as much as you can, and then to talk with other people who you think are reasonable people, who you value, who have been going out a little bit more than you have. Ask them their take on it and their perspective. People who are calm, because again, anxiety or calm is both very catching. So you want to be around calm people, hear their experience, and then take baby steps. Right? I mean, go out to the doctor, for instance. It's really important for people to take care of themselves, and a lot of people have been avoiding that. Yeah. And people have actually ended up becoming sick by not taking care of their ongoing health problems. Yeah. We don't want to see that.
No. And Jennifer, if you're still watching, if you need more information about what's being done to make sure our offices and our doctors' offices are safe, call your physician and call the place where you need to go and ask them how they're keeping you safe. And I think you'll come to find that there are a number of steps we've taken. And you can also watch some of our other community conversations for some more details around that as well. So, we have a question that's just come in via Facebook, and it kind of harkens back to when I asked you earlier about the things that may make us more susceptible to anxiety or depression or anything along those lines. And she has a question about whether an individual's family background, ethnic background, things along those lines. We are all, I think it's important to reiterate that at the end of the day, we are all sort of susceptible to this, and that there's no one group of people who are more or less or anything along those lines.
No, I think that the anxiety and worry and uncertainty is universal, and everyone is experiencing the anxiety around that, everyone. Some people have, as part really of their personality, style more than anything else, have a better ability to sort of deal with that, and doesn't get the best of them, to sort of compartmentalize it at time and do other things. Sure. For some people, that's very challenging to do, and so those people feel a lot more pain with it. But I do think it's universal, and it's not limited to one ethnic group or limited to one gender, etc. It's an opportunity for us all to be together, actually, on this. Yeah. And I think it's nice to find those opportunities in the world, as we kind of get very divided otherwise.
Dr. Bolo, we're just about out of time, but I want to thank you for engaging in this conversation, because I think for those who have been following along and for those who may see this afterwards, it may provide them with a bit of perspective that could be super valuable. So we have just a moment left. Any final thoughts you want to share?
I have a question for you, Luke.
See? See? You never know. These things can go. This is live TV.
Be ready. Is there anything that you found in your life that's been helpful for managing that anxiety and worry that we've been talking about?
And I thank you for the question. This is a nice alternative. And something you brought up earlier, very early in your remarks, struck a chord with me. And anybody who knows me knows that I have a very emotive way about me. My face, I gesture a lot when I talk. And having to wear masks has made it very difficult for me to sometimes connect with other people the way I used to in times past. I found it's almost been a bit of a barrier in that regard. And so that has been a challenge for me. So I think what I have tried extra hard to do is to think more about what I'm saying and how I'm saying it to people. And when I have conversations like we're having right now, and then you have to work a little harder to connect with people in that way, but it's I don't know, communication is always a two-way street in my opinion. And I think it's almost more rewarding to have to put the muscle effort in and to think more about how they're responding to what you're saying. I think you get more out of it. So that's been helpful for me. Yeah,
I'll just say that you connect very well.
Thank you.
And it's been great sitting here talking with you, and I really appreciate that. It made me feel uplifted and resilient today. So I appreciate you inviting me here.
Thank you, Dr. Bolo. I appreciate that. And thank you to everybody for joining us. We hope you enjoyed the conversation. If you have any questions, please reach out to us in the thread below the video, and we will get back to you. Thank you.